August 18th, 2020. Today we report 1,587 cases with 35 deaths, which is up 1 from yesterday. We have 6 people hospitalized currently. 3 of those are in the ICU. 292 of our active cases are home outpatient and 1,254 recovered, for a case fatality rate based on confirmed cases and deaths of 2.2%. And then again, a lot of monitoring continues between ourselves, Ingham County, and Trace Force, which is what the state is using to help us with contact tracing. So that's a contract through the state to do additional contact tracing. When we look at our hospitalization numbers, we're still doing well relative to where we were, in April. But as you can see here, we've gotten above that 5-person line here. So we do have a little bit of an uptick in hospitalizations over this last week, 10 days. So trying to get that number back down. When we look at the various, the distribution of our cases, we have 79% recovered, 2.2% deceased, 18.4% of our cumulative cases are home recovering, basically dealing with mild illnesses at home, and then 0.2% each in the hospital non-ICU, and then also in the hospital ICU. So if we look at that cumulative chart, which we are looking for that to flatten out, again, we saw a pretty good flattening here back in late May, early June, and we're kind of waiting for that to happen here again. So I don't think we're quite as flat as we were then, and I think that the rest of our charts will show you the same trend, which is that we did have a significant increase in the number of cases starting mid-June. They've been bouncing around a little bit, but when we throw that 7-day rolling average on it, you can see that we really are still dealing with that significant increase in cases. If we look at our percent positivity, we're holding really well down in the 2%-ish range of percent of our tests that are positive on any given day. So some of our increase in cases would then logically be an increase in testing. And we do know that there's an gradual increase in testing going on. And that actually might be some data we should start showing you so that you actually see the increase per day in testing numbers. I think some of those graphs are on the state's website, but we can pull those for you as well. So this is what that rolling average looks like when we basically smooth out those ups and downs. So we do have basically this continued downward trend, but as you can tell, it has taken us quite a while to get this trend down. We've got a little bit of an uptick in our percent positives right there on the last day that we have data for. When we look at our zip codes, we have still 48911 in the 331 to 340 case range, 48823 not far behind at 291 to 300, followed by 48910, 48864, 48812, and so on. So when we look at those cases on a map by the number of cases in any of those zip codes, you can see that shading as it gradually decreases. Again, 48911 right here, East Lansing 48823, and then these other zip codes, which include Okemos and 48910 in Lansing. So if we look at those by rate, though, we see the 48911 still high in terms of rate. East Lansing and Okemos also high in terms of rate. Weberville pops up. We don't calculate a rate for anything less than 20 cases, so you don't see a lot of other shaded areas in the out county. That Weberville zip code just did go above 20 cases, so we did calculate that rate. It is a fairly, geographically dispersed, and so basically it comes out colored that way. There's a very few cases out there. It's just a low population area. When we look at the heat map of cases across the county, it really hasn't changed much. This is what we've been looking at for quite a while now, with obviously quite a bit of heat in the 48911 area. This significant dot out here in the Okemos area is Ingham Medical Facility, the long-term care facility out there on Dobie Road. And then you see basically a fairly, more spread out cases throughout the East Lansing area, which we see better when we zoom in a little bit on the map. So you see these higher concentrations of cases in a number of areas, zip codes, including 48910, in particular 48823. And these zip codes here as well. I think this might be 48915, something like that. So we are 51% male, 49% female in terms of demographics of our cases. We still have that 20 to 29 age group being our highest percent of cases. That transition happened in June as that second surge of cases happened. So they are double any of our other age ranges. And then we look at our cases by race: 54% Caucasian, 24% African American, 9% Asian, 10% other, which includes Native Americans and Pacific Islanders and American Eskimos as well. So the rate calculation for that, though, looks like this, where our Caucasian population is at 400, African American population 1,151, so still about 3 times, and not quite twice the rate of our Caucasians with our Asian population. When we look at that by ethnicity, 81.2% Hispanic, not Hispanic or Latino, and 10% Hispanic or Latino. So again, we look at that by rate to adjust for prevalence of any given race or ethnicity or age group in a population. And so we have our not Hispanic or Latino at 477.6, and Hispanics or Latinos at 689. So I think that's about, that's less than 2 times, so 1.3 or 4, somewhere in there. When we look at our deaths by age, we are 42.9% over the age of 80, 31.4% 70 to 79, 14.3% 60 to 69, and 11.4% 50 to 59. We have had no deaths under the age of 50. By sex, 51.4% of our deaths are female, 48.6% are male. When we look at that by race, we have 65.7% of our deaths are Caucasian, 31.4% African American, and 2.9% other. And then if we look at that by ethnicity, we are 88.6% not Hispanic or Latino, 5% Hispanic or Latino, 5.7% Hispanic or Latino, and 5.7% other. So that is the end of the data for today. And so I can take questions. I'm going to guess what's on your mind, but I'll let you ask.
We do not have any questions in the queue currently, so if you have a question for Linda, feel free to go ahead. Go ahead, Megan.
So obviously, with the emergency order today, there's concern over cases being associated with MSU. Students come back. Do we know how many cases are currently associated with MSU students or employees?
I believe it's less than 30 right now, dealing with athletic training practices. So it isn't as much a reaction to cases on campus as it is a mitigation preventive measure to keep from having those issues on campus. So we're being proactive, not reactive here.
Okay, thank you.
Mm-hmm. If anyone has a question, feel free to chime in.
Hello, it's Rachel.
Hi, Rachel.
Question, what What other sports do you think that could play other than, or cannot play other than football?
That's a good question. So the governor's current executive order, to the best of my reading of it, does not exclude high school sports. So there is a separate section for professional sports. So what it says about athletics is that training, practices, games can be held outdoors so long as all participants, all coaches, all spectators maintain 6 foot of social distancing at all times, and equipment is shared to the minimum extent possible. So when you take that into account, and like I said, I have not seen any exemptions in the order for school sports at this point in time, then it becomes very difficult to play a lot of things. I don't know how you play volleyball and maintain 6 feet apart at all times. I know that some cross country is moving forward. My son was a cross country runner. I know when they start those races, they are kind of bunched together and, intentionally bunching together, trying to get their space to get to the front of the pack before they get caught behind them. So I don't know what's going to happen with cross country either. Football has been canceled in some districts. Some districts have chosen to basically not do all sports. Right now, you can golf, you can do tennis. I don't know which sports are fall sports and which sports are spring sports because my kids have not been in school for a long time. So, it is difficult to think of very many things that you can do and be consistent with those executive orders at this point in time. So I think we'd be waiting to see the MHSAA and the governor's office come to some sort of decision about what specifically is going to be allowed for schools, if it has to fall outside the current order, or how it is that school sports comply with the current order. Because like I said, I don't see an exception for them in it right now.
Okay, thank you.
Mm-hmm.
Go ahead, Robin.
Oh, you're muted.
You would think 5 months into using Zoom, we'd have it all figured out now, right?
I know.
So this is just kind of a more of a general question, not necessarily just about Michigan State, but you've got all these students going back to college, and there's this balance between wanting to test and catch something before it becomes a big cluster. On the other hand, you can't test every student every day. I mean, at some point, then you're just slowing down testing. Can you talk to me a little bit about the balance of how do you test enough, but not so much that it's not valuable anymore?
So, I struggle with that with testing, because testing is a test result is a moment in time. I mean, honest to goodness, each and every one of us could go out and get a test today and it could come out negative. And then we could go get a test tomorrow and it could be positive. All it tells you when you get a test is that you are negative today. So I think we have to strike the balance. One of the balances that we have to strike is knowing that and not letting a test result give you a false sense of security that I have a negative test result, I'm negative. You could be in the middle of an incubation period on your way to positive and we don't even know it. And so people need to maintain all of the proper, preventive measures. They need to keep their guard up, those sorts of things, whether they go in and get a test that says they're negative or not. Testing students is, a strategy that some schools have. Some schools are testing before they come back to campus to try to keep from many students coming back to campus that already have illness that then can be spread. I prefer the strategy of quarantine when they return to campus, because they could test just before they leave home. By the time they got here, 2-3 days later, I don't know what that test 72 hours ago means. And that's Penn State, I believe, is doing that. I saw a Penn State policy about testing 72 hours before returning to campus from high transmission counties, and they would notify students if they needed to get tested. So testing has its place. but as just a broad screening in areas, for everybody. It's a better screening tool in like congregate settings, long-term care facilities, correctional facilities, things like that. So could potentially be effective in dormitories or things like that. It really just depends on the degree to which we have like a congregate setting. So the university is looking at doing what they call some pooled testing. It would be a saliva test. So it's not CLIA. CLIA is Clinical Laboratory Association. Waived test for confirmatory testing. It's not, that doesn't do a confirmatory testing. It's kind of like an initial screen. So after they did that initial screen, if there were positives, they would send them for a confirmatory test. They can do those basically by pool testing. What you mean is you take, say, 10 or 15 people's samples, you put it all in one, specimen, one well of a plate is the way it works. And then if that particular well comes out positive, then you know that one of those 15 people, let's give it 15 for example, is positive. Mm-hmm. If you cross them enough times to where you have duplicates of certain people in different wells, you can eventually kind of tease that apart and figure out within a certain pooled sample a person or at least a couple of people that are more likely to be your positives to send on for confirmed testing. So there's all kinds of science that goes into figuring out the calculations to make that happen. And I am way out of working in laboratories to explain that to you. So I'll let the MSU
This is helpful, thank you.
Explain it. So pooled testing could be useful and cut down on the amount of confirmatory testing that would need to be done. Because I do think that we need to reserve that confirmatory testing for those more serious congregate settings, as well as, testing in the community. We don't want to get to a point again where we have a problem with not having enough testing. And so we just have to make sure that we have the capacity to do the things that we're intending to do. And so when it comes to broad, just, test students every week or every 2 weeks, I'm not sure that that is going to be the best use of broad confirmatory testing strategies. So.
Can I ask a follow-up just to clarify, unless somebody else is
Sure.
waiting? When you're talking about congregate settings like nursing homes or prisons versus the dormitories, I think I understand the difference, but could you clarify that a little bit more?
So your dormitories are a little less, so the other congregate setting I would give you is a typical public school, especially in the elementary ages where we know all day long those students are typically in a single classroom. So similar nursing homes, jails, those sorts of things. So when you start to talk about dormitories, I don't know about you, but when I lived in the dormitory, I wasn't in the dormitory all the time, nor was everybody else that lived in the dormitory. So we weren't necessarily all there, interacting with each other in kind of single communal space for hours and hours a day. So that makes it a little bit different when there's all that moving around and different interacting. Most of your social gatherings might be with a friend that lives in a different dorm. And so it just plays out a little bit different than in those more contained congregate settings. So it would be a place to consider, that kind of, screening kinds of testing is dormitories, things like that. But again, I think that it's a little bit of a different level than nursing homes, jails, correctional facilities, and even when you get into public schools, which we typically consider to be congregate facilities. I mean, think of all the places where we typically have norovirus outbreaks. Those are the places, that we need to be considered. And elementary schools are common, nursing homes common, and I don't think quite as much at jails or correctional facilities, but those are really common places for norovirus outbreaks.
Basically where people stay put. Okay, thank you.
Mm-hmm.
Anyone has a question, feel free to go ahead.
The emergency order, this is Rachel, by the way, hello again. Are you going to be, it's in effect immediately and then it's going to kind of go on until there's no known date yet?
It is immediate and indefinite. So as you might guess, the reason for immediate was if I issue an order today and say it goes into effect tomorrow and it prohibits large gatherings, gosh knows how many people might plan a large party tonight. So basically that was the reason for it going into effect immediately rather than basically having a lot of advance notice to that. Indefinitely is because we really just don't know what's going to happen. We're going to have to see what happens when students come back on campus. I've seen things, I just saw a comment on our Facebook post about, I get this, but what about the unintended consequence of people going inside now where you don't see them? Gatherings inside are limited to 10. We're aware that people could go inside instead of staying outside for these parties. We can't create a perfect system in a perfect bubble. We've got to do the things we can and then deal with even some of the unintended consequences that we anticipate could be a problem. So landlords, fraternity, sorority folks have been working with the city as well as MSU to talk about how are they going to manage not having those large parties indoors as well, and how are we going to monitor and regulate that. So I believe the Greeks are looking at some sort of moratorium on social gatherings. I don't know where they are with that, but I know that that's something that's being considered. We're also going to have to look at, the potential kind of squeeze out effect. So when we have that kind of restriction on gatherings in a section of East Lansing, one becomes concerned that potentially parties could kind of just crawl their way up, say, Chandler Road or into Meridian Township. So we're going to have to be watching that and figuring out, one, are we getting cases? Is it true that we are getting cases still because of large gatherings and parties, and do we need to keep them down? And if so, and people are starting to escape out of this boundary in order to have these larger parties, are we going to have to redefine that boundary? All of that is something, those are all the things that we have to watch as this potentially moves on us. We have put into place something that we think has got great potential to help us a lot. I mean, it's very well supported in the data from noise ordinance violations that the vast majority of large parties are, associated with that noise and are in kind of that area where we have drawn that boundary. So it was a hard thing to do because originally it was kind of like, wow, a gathering limit on the entire city of East Lansing, that affects a whole lot of people that perhaps would want to have an outdoor wedding or something like that then wouldn't be able to do that. So trying to avoid impacting the entire city of East Lansing by finding an area of East Lansing that can be scientifically identified and justified in terms of the order. But again, we will be watching it, and if there are necessary modifications, we're prepared to make them.
Thank you. And then a follow-up to that, can you talk a little bit about how the ticketing was decided or how it will work?
Okay, so there's a health officer epidemic order, an emergency order to control an epidemic is we don't write tickets. I don't issue a ticket. So it basically falls under the public health code. A violation of the order is a misdemeanor, punishable by, I forget, is it 6 months and $200? One or the other, yeah, or both. We don't generally get to that place. Generally what happens is we go in and we were like, you've got a copy of the order in your hand and it's like, this is a violation of this order. You're going to have to break it up now, or this is what could happen. So in this particular case, there is also a state law that says a police officer can arrest someone if they witness them violating something that is a misdemeanor or an ordinance or things like that. So the police do have the ability to do that. The process for the penalty, though, is more of a court process. So the first thing we do is we issue what's called a cease and desist when we find people violating orders. So we pretty much tell them that they're going to have to stop violating the order, or we're going to take them to court for the penalty. So it's kind of a complicated process for enforcement, but generally what happens is just basically being told that this is an order, it is enforceable, it is, it does carry a penalty with it, usually helps just break things up. And we very infrequently find ourselves at a point where we really truly have to take somebody to court over violation of an order. Doesn't happen very often.